Now, how to find out the bleeding time? Usually the common method is a small wound or a small stab wound is made on either on the earlobe or on the forearm. Maybe Duke technique or IV technique is called Duke technique, or if it is in the forearm, it's called IV technique. Now, a small stab wound is made. Then after that the wound is blotted in every 30 seconds by a gauze piece. So every 30 seconds you have to blot the wound. Now, once the bleeding stops, we are keeping on blotting it. Once all bleeding stops, the test is over, and we have to find out how much time it has taken to stop. That is, the bleeding time is the time from the swab of the wound, from the swab wound to the time that no further bleeding is detectable. That time is called bleeding time. Now, if there is a prolongation of bleeding time, it is commonly seen in thrombocytopenia, then there is a platelet malfunction is there, and there is any abnormality in the clotting factors, or hypofibrinogenemia, that is decrease in the number of fibrinogen. This also leads to a prolongation of bleeding time. Now, clotting time. Clotting time, if you are keeping a blood in a glass tube, how much time it takes to clot? This is known as clotting time. Cut. Now, regarding plasma, in the first slides we discussed the components of the blood, that are the 55% of the blood is the plasma, and the remaining part 45% is the cells. Now, the cells, we already discussed all the three types of cells, that is 45% of is the cells, and we already discussed regarding the RBC, WBC and platelets. These were the cells. Now, the remaining portion, that is these are the cells, these are the plasma, that is all these cells are seen in the plasma itself. Now, plasma is a pale yellow liquid that remains when the elements are removed from the blood. So, once we are removing all these RBC, WBC and platelets, the things what we get is called plasma. Now, we already discussed that plasma is around 55% of the it comes around the 55% all blood. And once we see the components of plasma, 90% of the plasma is made of water, and the remaining part is proteins. Plasma also contains nutrients, electrolytes, oxygen, enzymes, hormones and waste products also. The main function of plasma is fighting against infection, and it also helps in clotting or coagulation of the blood. Now, plasma contain, I told you 10% of the plasma is plasma protein itself. It constitutes 10% of the plasma. There are three types of plasma protein commonly seen. These are albumin, globulin and fibrinogen. Albumin account 60 to 80% of the blood among the plasma. That is, among the plasma protein, 60 to 80% is albumin. Globulin is the protein which carry lipids, and fibrinogen, we already discussed, it serves as a clotting factor. So, plasma protein, there are three types of plasma protein. The major protein is albumin, that is 60 to 80% is albumin. The next is globulin and fibrinogen. Globulin which carries the lipid, and fibrinogen serve as clotting factor. Now, we will be knowing about the different types of blood grouping. We will be knowing A group, B group, O, etc., AB, etc. There are especially 4 types of groups commonly used. Now, it is determined by 2 things, that is determined by antigens, mainly determined by antigens. That is determined by antigens or agglutinogen on the surface of the RBC. Now, these antibodies, agglutinins, can bind with RBC antigen, result in agglutination or clumping or hemolysis of the RBC. Now, there are 3 groups. Grouping can be done like AB O group and RH type of group. RH may be positive or negative, A, B, O, etc. Now, usually 4 types of blood group. Once we go through the A, B, O blood grouping, 4 types of blood groups commonly seen. These are type A, type B, type AB and type O. Type A means there is antigen A is there, anti-B antibody is there. Then antigen B, in the type B blood group, that is, it contains antigen B, and type AB blood group, it contains both antigen A and B, and type O blood group, it's neither contain antigen A nor antigen B. So there are 4 types of blood group. Antigen A contain A group, antigen B containing B group, antigen AB contain antigen both A and B contain, that is AB group. If neither of these antigen is not there, then it is called O group. Now we may heard about there is RH, that is A positive, B positive, then B negative, then O positive, O negative, etc. This negative and positive is due to the presence of a factor called RH. If RH is present, that is RH is present, it is known as RH positive. That is RH positive. And if RH is not there, so it is called RH negative. So in case of A group, there will be antigen A, and A positive means antigen A and presence of RH factor, RH is there. So it's called A positive. RH positive have this antigen present in the surface of RBC, and RH negative does not have RH factor in the antigen. So A negative means there is antigen A and there is no RH. So like this blood grouping is done. Now blood transfusion. Blood transfusion is a procedure in which blood is given to the patient through an IV line in one of the blood vessels. Blood transfusion are done to replace the lost blood because of lots of, in case of during a surgery or any road traffic accident, there is chance of loss of blood loss. So in order to make the blood loss proper, we replaces the blood. So this is called blood transfusion. So blood transfusion are done to replace the blood loss during surgery or a serious injury. A transfusion may also be done if the person's body cannot make the blood properly because of any illness. Now who can give blood? Now type O, a person who is having type O is known as universal donor, because they can give blood to any group because it does not have any antigen. Now people with AB is called universal recipient because they can receive any blood group. Now RH positive can receive both, and RH negative can only receive negative. In this session we discussed about the different functions of the blood, which are the different components of the blood, how much is the percentage of plasma, how much is the percentage of the cells, and which are the different cells seen in the blood, that is RBC, WBC and platelets, and how the RBC and these cells are formed and how it is getting destroyed, and what happens there is an increase in the level of RBC, what happens there is any decrease in the level of RBC, which are the common disorders, what is the name of these common disorders. We also discussed about how the blood clotting occurs, and we also discussed about the different plasma proteins and what is blood grouping and what is meant by blood donation. We will be discussing about blood pressure. Blood pressure can be defined as the pressure exerted by the circulating blood upon the walls of the blood vessels. Usually once we say the blood pressure, there will be two values. We used to record it is. We used to mention it as two values. It is actually a systolic and diastolic blood pressure. So blood pressure is usually recorded as two values. The first one is systolic blood pressure. It is the pressure as the heart beats, and a diastolic pressure as the heart relax between the beats. So there are two blood pressures are there. One is a systolic blood pressure and the diastolic blood pressure. Now systolic BP or systolic blood pressure is the highest BP recorded during a cardiac cycle, and diastolic BP is the lowest BP recorded in cardiac cycle. So systolic is the BP, systolic BP is the BP measured once there is a contraction, and that is once there is heartbeats, and diastolic BP is the BP which is recorded during the relaxation. Now the difference between systolic BP and diastolic BP is known as pulse pressure. Usually a normal BP is usually considered as a reading of 120 millimeters of mercury bar 80 millimeters of mercury is considered as normal. That is, normal systolic BP is 120 millimeters of mercury, and the diastolic BP is 80 millimeters of mercury. This is considered as normal. Now, if the reading is sustained reading more than 140 to 90 is considered as high BP. It's also called, then it can be called as hypertension. The causes may be different. It may be main cause is a narrowing of the blood vessels due to some fatty deposits or hardening of the arterial walls. And if the BP is low, if it is low, less than 90/60 or lower, this condition is called hypotension. Now how we can measure BP? There are lots of manual and mechanical devices which helps to determine BP. Now the most common, the symbol and the golden standard is the sphygmomanometer measurement. Now how we will measure, what is the recommended technique for that? That is, patient should be sitting in a relaxed sitting, and the arm should be supported, and ensure that there is no tight clothes which restrict the arm. Now the cuff must be at the level of heart. If the arm circumference exceeds more than 30 centimeters, then you have to change the cuff, you have to go for a large cuff. Now place the stethoscope or diaphragm over the brachial artery. Then the column of the mercury should be vertical. Then inflate to occlude the pulse, deflate to 2 to 3 millimeters per second, and measure the systolic BP. Systolic BP is the first sound you hear. Then you keep on deflating, and once this sound disappears, this is considered as diastolic BP. So your patient should be in sitting position, relaxed position. You put the cuff, put the stent over the brachial artery, then you start inflating it and to a level and start deflating. Then you can see a sound starts. As the sound starts, the first sound starts, that is considered as systolic BP, and the sound keep on increasing, then keep on decreasing, and it goes disappear. This point is known as diastolic BP. So this is the golden standard of measurement of BP. Now nowadays there are lots of automatic BP devices are available, and there are some benefits when compared to the manual BP. There are some benefits for automatic device. The first one is that once we are taking BP measurement, there may be chance of individual difference. That is, chance of individual errors may be there. So once we standardize BP, we'll get a standard measurement. There won't be any operator error or an individual error. So there will get a standardized BP reading from one operator to the next. So there won't be any personal errors won't be there. Now, So other than that, once we do any manual work, there may be more chance of more errors. Individual errors may be there. These errors can be avoided by using an automatic device. And most of these automatic devices are accurate, reliable, and we can reproduce the reading. And if we have some doubt, go for multiple reading and average. So this can be done by using this automatic device. Then once after each point it goes into automatically, it goes into 0. Now there are some factors which determine BP. These are especially, there are two factors. The first one is the cardiac output and second one is the peripheral resistance. Peripheral resistance depends upon the viscosity, radius of the blood vessels, viscosity, the radius of blood vessels and length of how much length the vascular tree is. If the viscosity of the blood rises, for example, number of RBC increases, factors like that is called polycythemia, the viscosity of the blood increases, and in this case there is an increase in the BP. Now radius of the blood vessels, as there will be, it causes a change in the BP. So it depends upon, again, the radius of the blood vessels depends upon how much tone is there in the smooth muscles. So as the tone of the smooth muscles in the artery changes, according to that BP also changes. So tone of the smooth muscles changes. So for example, if there is a sympathetic discharge, there is chance of vasoconstriction or a vasodilatation. So this causes a change in the BP. Again, a chemicals like angiotensin or adrenaline causes a change in the smooth muscles tone and later leads to a change in the BP. Now there are certain regulation factors which regulates the BP. How the BP is getting regulated? In order to control BP, we can divide the control into two types of control: a short-term control and a long-term control. Short-term control of BP include mainly the sine-aortic reflexes and the reflexes from arterial receptors and stretch reflex from the left ventricle. Long-term control of BP is achieved through renin-angiotensin aldosterone axis. Now, which are the conditions which affect the BP? Age. As the age increases, BP also goes increasing. Next one is sex. That is, before menopause, women having a lower level of BP than males. But after menopause, women is having a higher level of BP than males. Now after meals, BP is little higher. Then emotions. Certain emotion causes an increase in the BP, certain emotion causes a decrease in the BP. Now if there is an exposure to cold, it causes a rise in BP. A muscular exercise, just after muscular exercise, there will be rise in systolic BP and fall in diastolic BP. But a person who is doing regular exercise, his BP will be less. And sleep. Sleep causes a fall in BP, but a nightmare dream may cause a sudden rise in BP. So these are the factors which affect the BP. In this session, we discussed about what is meant by BP, and what is BP, what is blood pressure, and how it is recorded, how it is measured, and which are the different devices for the measurement of blood pressure, and which are the factors which determine the blood pressure, and how the BP is regulated, and which are the conditions which affect the BP. Thank you. The intermediate extrinsic muscle group include two muscles. This is a serratus group, including serratus posterior superior and serratus posterior inferior. Now there are intrinsic back muscles are there. Intrinsic back muscles include iliocostalis muscle, longissimus muscle and spinalis muscle. There are intrinsic back muscles are iliocostalis, longissimus, spinalis, semispinalis and multifidus muscles are there. So, back muscles can be divided into 3 groups. The back muscles have been arranged into 3 groups. These are the superficial extrinsic group, intermediate extrinsic group and deep intrinsic group. So, superficial are trapezius, latissimus dorsi, levator scapula, rhomboids major, rhomboids minor. I have to band kar lijiye. Now, the back muscles have been divided into 3 different groups: a superficial extrinsic group of muscle, intermediate extrinsic and intrinsic back muscles. Superficial group includes the trapezius, latissimus dorsi, levator scapula, rhomboids major and rhomboids minor. So, we will go through the origin, insertion, and regarding the trapezius. Trapezius is origin from the medial 1/3 of the superior nuchal line, external occipital protuberance, ligamentum nuchae, spinous processes of the vertebra C7 to T12. Now, it is inserted to the lateral 1/3 of the clavicle, acromion process and spine of the scapula. Now, its action of the trapezius include elevation and depression of the scapula depending upon which part of the muscle contracts, and it rotates the scapula superiorly and retract the scapula. It is innervated by 2 innervation, that is spinal accessory nerve and proprioceptive innervation from C3 to C4. Next muscle is the next superficial extrinsic muscle is the latissimus dorsi. Latissimus dorsi origin from vertebral spines from T7 to the sacrum, and T7 to the sacrum, posterior 1/3 of the iliac crest, lower 3 to 4 ribs and inferior angle of the scapula. So, latissimus dorsi origin from the vertebral spine from T7 to sacrum, posterior 1/3 of the iliac crest, lower 3 or 4 ribs, inferior angle of the scapula, and is inserted at the floor of the intertubercular groove. Its action is extend the arm and rotate the arm medially. Innervation is thoracodorsal nerve from the posterior cord of the brachial plexus. Next muscle is the next superficial muscle is the levator scapulae. Its origin is from the transverse process of the C1 to C4 vertebra and inserted into the medial border of the scapula from the superior angle of the spine. Its action is elevation of the scapula and is innervated by dorsal scapular nerve, and upper part of the muscle receive branches from C3 and C4. Next muscle of the superficial extrinsic group is the rhomboids major. Its origin from the spinous of the vertebrae T2 to T5 and is inserted to the medial border of the scapula inferior to the spine of the scapula. Its action is retracts, elevates and rotates the scapula, which depresses the glenoid fossa. So, its action is retraction, elevation and rotation of the scapula is the action of the rhomboids major muscle. So, innervation is done by dorsal scapular nerve. Next muscle of the superficial extrinsic group is the rhomboids minor. Rhomboids minor originates from the inferior end of the ligamentum nuchae, spines of the vertebra C7 to T12. It is inserted to the medial border of the scapula at the root of the spine of the scapula, that is rhomboids major. Rhomboids major does retraction, elevation and rotation of the scapula, and which depresses the glenoid fossa and innervated by dorsal scapular nerve. So, these were the muscles of the superficial extrinsic group. Next muscle group is the intermediate extrinsic muscle groups. This intermediate extrinsic muscle group includes the serratus posterior group. It includes the serratus posterior superior and serratus posterior inferior. So, For the first muscle is in the intermediate group is the serratus posterior superior. Serratus posterior superior originate from the ligamentum nuchae and spines of the vertebra C7 and T1 and T1 to T3, and is inserted to the ribs from 2nd to 5th ribs and lateral angles to the ribs. So, its origin from the serratus posterior superior originate from the ligamentum nuchae and spines of the vertebra C7 and to T1 and to T3, and is inserted to the ribs, that is 2nd to 5th ribs and lateral to the angles of the ribs. And its action of the serratus posterior superior is elevation of the upper ribs, and is innervated by branches of the ventral primary rami of the spinal nerve T1 to T4. Next muscle of the intermediate muscle group is the serratus posterior inferior. It originates from the thoracolumbar fascia and from the spines of the vertebra T11, T12, L1 and L2, and inserted to the ribs 9 to 12, and it's from the lateral angles of the ribs 9 to 12 ribs. So, its action is it pulls down the lower ribs and it's innervated by branches of the ventral rami of the spinal nerve T9 to T12. Next muscle is the iliocostalis. These are intrinsic muscles. The next group of muscles are the intrinsic group of muscles. So, intrinsic muscle groups includes iliocostalis, longissimus, spinalis, semispinalis and multifidus. The first muscle is the iliocostalis. It's iliocostalis, and it's originate from the iliac crest of the sacrum and inserted into the angle of the ribs. Its action of the iliocostalis is it extend and laterally bend the trunk and neck, and it's innervated by dorsal primary rami of the spinal nerve C4 to S5. Other muscles are longissimus, spinalis, semispinalis and multifidus. Another muscle is the erector spinae. Another intrinsic muscle is the erector spinae. Its main function is the extension of the trunk. This is one of the extensor of the trunk. So, this erector spinae is having two parts, longissimus thoracis group and iliocostalis muscle group. Now, it can be divided into superficial and deep layers. Longissimus thoracis, pars thoracis and iliocostalis pars thoracis are the superficial erector spinae group, and iliocostalis pars lumborum and longissimus thoracis pars lumborum are the deep muscle group. So, erector spinae muscles are the extensors of the trunk. Next muscle group is the multifidus muscle group. Multifidus muscle group consists of a number of fleshy tendinous fascicles which fills up the groove on either side of the spinous process of the vertebrae from sacrum to the axis. So, multifidus is a number of fleshy tendinous fascicles and which fills groove on the either side of the spinous processes of the vertebra from sacrum to the axis. So, we were discussing about the muscles of the back region. So, we divided the muscles of the back region was divided into superficial extrinsic muscle group, which include the trapezius, latissimus dorsi, levator scapula, rhomboids major, rhomboids minor, and an intermediate extrinsic muscle group which include the serratus posterior superior and serratus posterior inferior. And there is another muscle group called intrinsic back muscle group, that is the most deep muscles. It includes iliocostalis, longissimus, spinalis, semispinalis and multifidus muscle. Next we will be discussing about the lower limb muscles right now. We will be starting with the muscles of the buttocks. The first muscle on the posterior region of the buttock is the gluteus maximus. This is the largest and most superficial muscles among the gluteal muscle group, and it makes a large portion of the shape and appearance of the buttocks. Now, gluteus muscle, gluteus maximus. First, we were discussing about the gluteus maximus muscle, which is the largest and most superficial muscle of the gluteus muscle group, and the gluteus maximus origin from the gluteal surface of the ilium, lumbar fascia, sacrum, and sacrotuberous ligament, and it is come down and inserted into the gluteal tuberosity of the femur and iliotibial band or iliotibial tract. Now, the action of the gluteus maximus is external rotation and extension of the hip joint. It supports the extended knee through IT band, and it is one of the chief anti-gravity muscle during sitting. So, its action, it is a posterior muscles of the buttocks, and its main function is the extension and external rotation of the hip joint, and it supports the extended knee through the IT band, and it is one of the chief anti-gravity muscle, especially in sitting posture. So, and the nerve supply is from the inferior gluteal nerve. Next muscle of the gluteal region is the gluteus medius, and its origin from the gluteal surface of the ilium, and it is situated under the gluteus maximus muscle, and is inserted to the greater trochanter of the femur. Nerve supply is from the superior gluteal nerve, that is from the L4, L5 and S1 nerve roots. The function of the gluteus medius is it abducts the hip, and it prevents the adduction of the hip also, and it is the medial rotator of the thigh. So, gluteus medius is the abductor and it is the medial rotator of the thigh, and it originates from the it is situated below the gluteus maximus, and it is originated from the gluteal surface of the ilium and inserted to the greater trochanter of the femur. Nerve supply of the gluteal medius is superior gluteal nerve, whereas the gluteus maximus, it is inferior gluteal nerve. Next muscle is the next gluteal group muscle is the gluteus minimus, and it originates from the gluteal surface of the ilium under the gluteus medius muscle. So, gluteal surface of the ilium under the gluteus medius muscle, and it is inserted to the greater trochanter of the femur, from gluteal surface of the ilium to the greater trochanter of the femur. Again, its nerve supply is the superior gluteal nerve. The nerve supply is similar to that of the gluteus medius, and that is L4, L5, S1 nerve root, that is the nerve is superior gluteal nerve. It works in concert with the gluteal medius and for the abduction of the hip, and it is the medial rotator of the thigh. So, gluteus medius and gluteus minimus work together for the abduction of the hip and the medial rotation of the thigh, and it prevents the adduction of the hip. Now, next muscle is the tensor fascia lata. Tensor fascia lata is a small muscle which attaches inferiorly to the long thick strip of fascia known as IT band. So, tensor fascia lata is continuous down as IT band or iliotibial band. Now, the origin of the tensor fascia lata is from the anterior iliac crest of the ilium, and is inserted to the lateral condyle of the tibia through IT band. Action of the muscle is flexion of the hip and abduction of the hip. So, tensor fascia lata, and it is tensor fascia lata continues inferiorly as IT band, and it originates from the inferior iliac crest and the ilium, and is inserted to the lateral condyle of the tibia through IT band. So, its action is flexion and abduction of the hip, and its nerve supply is from the superior gluteal nerve. Next important muscle on the buttock is the piriformis. Piriformis originates from the anterior surface of the lateral sacrum and is inserted to the greater trochanter of the femur. Action of the piriformis is it is the external rotator of the hip, and it is a hip abductor also. So, piriformis originates from the anterior surface of the lateral sacrum and inserted to the greater trochanter of the femur. Its action is it is an external rotator of the hip, and it is a hip abductor also. nerve supply is from the branches of the brachial plexus. Next muscle is the obturator externus. Obturator externus originates from the obturator foramen and from the obturator membrane and is inserted to the medial aspect of the greater trochanter of the femur. Now, its nerve supply is from the posterior branch of the obturator nerve, that is L3 and L4, and its main action is it is the adductor of the thigh and it rotates the thigh laterally. So, it is the lateral rotator and adductor of the thigh at the hip joint. So, obturator externus originates from the obturator foramen and obturator membrane and is attached to the greater trochanter, and posterior branch of the obturator nerve is the nerve supply and is the adductor and lateral rotator of the thigh. Next muscle of the buttocks region is the obturator internus. It starts its origin from the sky of pubic ramus and obturator membrane, and it is attached to the medial aspect of the greater trochanter, and the nerve supply is nerve to the obturator internus, that is L5, S1 and S2 branches, and its main action is it abduct and rotate the lateral rotation and abduction of the thigh, and it is the stabilizer of the hip during walking. So, obturator internus, it abduct and lateral rotate the thigh, and it is the stabilizer of the hip during walking. Next muscle is the inferior gemellus. Inferior gemellus originates from the ischial tuberosity and it is attached to the obturator internus tendon. Now, the inferior gemellus, the nerve supply is nerve to Quadratus Femoris and it rotates it is a lateral rotator of the thigh. So, inferior gemellus start from the ischial tuberosity and attached to the obturator tendon, and the nerve supply is the nerve to Quadratus Femoris and it rotates laterally to the thigh. Lateral rotation of the thigh at the hip joint is the function of the inferior gemellus. Next muscle is the superior gemellus. It starts from the spine of the ischium and it is attached to the inferior obturator internus tendon, and it is nerve supply is from the sacral plexus, that is from the S1, S2 and S3. Superior gemellus, it rotates the lateral it is a lateral rotator of the thigh at the hip joint. So, superior gemellus starts from the spine of the ischium and attached to the obturator internus tendon, and its nerve supply is from the sacral plexus and it laterally rotates the thigh. Next muscle is in the buttocks region is the Quadratus Femoris. Quadratus Femoris originates from the ischial tuberosity and it is attached to the intertrochanteric crust, and the nerve supply is nerve to Quadratus Femoris, and its main function is its action is it is a lateral rotator of the thigh. So, we were discussing about the muscles of the buttocks region. There are three gluteal muscles can be seen. These are Gluteus Maximus, Gluteus Medius and Gluteus Minimus. Then the other muscles in the buttocks region are tensor fasciae lata, piriformis, obturator externus, obturator internus, inferior gemellus, superior gemellus, Quadratus Femoris. Now, we will be discussing about the muscles of in front of the thigh. Muscles of the in front of the thigh, especially these muscles are the hip flexors, and these are the main muscles of the hip flexors are iliopsoas muscle group. That is, iliopsoas muscle group consists of two muscles, that is iliacus and psoas major. There are accessory hip flexors. These are rectus femoris, sartorius and pectineus. The iliopsoas is the chief hip flexor. So, it is seen on the anterior side of the thigh and it is consists of two muscles, iliacus and psoas major. So, iliacus it originates from the iliac fossa and is inserted to the lesser trochanter, and its action is flexion and lateral rotation of the thigh at the hip joint. And the second action is it flexes the trunk and the pelvis over the thigh, and the nerve supply is from the femoral nerve. So, iliacus muscle is originated from the iliac fossa and it is inserted to the lesser trochanter of the femur, and its action is flexion lateral rotation of the thigh and flexion of the trunk if the pelvis is over the thigh. So, these are the chief flexors of the hip joint and its nerve supply is from the femoral nerve. Next part of the iliopsoas group is the psoas major muscle. It is a long fusiform muscle located on the side of the thoracic region of the vertebral column and brim of the lesser pelvis. It joins the iliacus muscle and forms the iliopsoas muscle group. So, psoas muscle, it originates from the transverse process of the T12 to L5 and the lateral aspect of the disc between them. So, inserted into the lesser trochanter of the femur, and its action is it flexes and laterally rotate the thigh. These are the chief flexors of the thigh, at the hip region, and it laterally rotate the thigh. And nerve supply is from the lumbar flexors, that is through the anterior branches of L1 to L3 nerve. Another muscle which is seen on the anterior side of the thigh is the quadriceps muscle. The main function of the quadriceps muscle is the extension of the knee joint. Along with that, one of the quadriceps muscle, rectus femoris, helps in the flexion of the hip joint, because this muscle rectus femoris is a two joint muscle. It's having action at both at the knee joint and the hip joint. So, the quadriceps muscle group consists of 4 muscles. These are seen on the anterior side of the thigh, and it include rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. So, it consists of 4 muscles. The rectus femoris, by the name itself we can understand that it contains 4 muscles, that is rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. So, rectus femoris and vastus intermedius, it's exactly seen at the center, and vastus medialis is on the medial side and vastus lateralis on the lateral side. Vastus medialis is having 2 parts, a vastus medialis obliquus and vastus medialis longitudinal. So, vastus medialis obliquus and longitudinal, it pulls the patella medial side. At the same time, vastus lateralis pulls the patella on lateral side, and we will get a posterior pull. The net pull will be a posterior pull which stabilizes the patella on the femur. Now, the quadriceps muscle consists of 4 muscles, that is rectus femoris, vastus medialis, vastus lateralis and vastus intermedius. Rectus femoris is the one of the 4 quadriceps muscle, and its origin is from the anterior inferior iliac spine. It starts from the anterior inferior iliac spine and it is inserted to the patella. So, it is inserted to the patellar tendon as one of the 4 quadriceps tendon. So, all this quadriceps muscle and it makes a common tendon called quadriceps tendon to the patella. From the patella it goes down, it attached to the patella, and from the patella there is another tendon called patellar tendon, and it is attached to the tibia or the tibial tuberosity. Now, origin of the rectus femoris is from the anterior inferior iliac spine, and it is inserted to the patellar tendon as one of the 4 quadriceps muscle. So, we already discussed its action. Its action is knee extension and along with that hip flexion, because it is having action at the hip joint also, because it is a 2 joint muscle. So, its action, the rectus femoris these are the chief knee extensors. Along with that knee extension, it flexes the hip joint also. Nerve supply to the rectus femoris is from the femoral nerve. Vastus lateralis is a 1 joint muscle, and it's also included in the quadriceps group, and its origin is from the greater trochanter and intertrochanteric line and linea aspera of the femur. So, it originates from the greater trochanter, intertrochanteric line and linea aspera of the femur. Now, it is attached to the patella and tibial tuberosity. First of all, it makes a common tendon called quadriceps tendon, and attached to the patella from the patella it makes another tendon called patellar ligament or ligamentum patellae or patellar tendon, and it attached to the tibial tuberosity. The nerve supply of the vastus lateralis again is the femoral nerve, and its main action is extension of the knee and stabilization of the knee. So, vastus lateralis is the muscle which extend another quadriceps muscle which helps along, which work together along with the other quadriceps muscle and extend the knee. Another important muscle in the thigh region which is seen in the thigh region is the sartorius muscle. Sartorius muscle is the one of the longest, it is the longest muscle of the body. It is also known as Taylor's muscle, and it's a long thin muscle that runs down the length of entire length of the thigh. So, sartorius originate from inferior to the anterior superior iliac spine, and it is inserted to the anterior, it is inserted to the anteromedial surface of the upper tibia in the pes anserinus. Its action is flexion, abduction and lateral rotation of the hip and flexion of the knee. So, action of the sartorius is flexion, abduction and lateral rotation of the hip and flexion of the knee. Nerve supply of the sartorius again it is the femoral nerve. So, sartorius its action is flexion, abduction and lateral rotation of the hip and flexion of the knee. Now, the hip extensors we already discussed both extensors. These are the gluteus maximus. We already discussed one extensor. The chief extensor of the hip is gluteus maximus, and another extensor is the hamstring muscle. Hamstring muscle, gluteus maximus, we already discussed about the gluteus maximus muscle group. Then hamstring we will be discussing it later. Then there are some muscles which causes hip abduction. Hip abductors are gluteus medius and gluteus minimus. We already discussed about its origin and insertion, and there are accessory muscle which causes hip abduction. These are tensor fascia lata and sartorius. So, these muscle also we already discussed. Now, hip adductors. There are three muscles are there which causes adduction of the hip. The hip adductors are adductor longus, adductor brevis and adductor magnus, and there are accessory muscles which adduct the hip. These are pectineus and gracilis. So, the first muscle is the adductor longus. Adductor longus origin from the superior pubic ramus just below the crest. So, origin of the adductor longus is from the superior pubic ramus just below the crest. Now, the adductor longus inserted to the linea aspera, middle third of the linea aspera of the femur, the adductor longus is inserted. So, we know as the name itself, these are the muscle, this is the muscle which causes the adduction of the hip, and it also helps in hip flexion. Nerve supply, the adductor group, the adductor longus is supplied by the obturator nerve. Second muscle of the adductor group is the adductor brevis. Adductor brevis, it originates from the pubic bone and it is inserted to the upper part of the femur. Now, action of the adductor brevis is, these are the hip adductors, and this also helps in hip flexion. Nerve supply, again the adductor group, adductor brevis also supplied by the obturator nerve. Next muscle in the adductor group is the adductor magnus. Adductor magnus is the largest adductor group muscle, and its origin it's having two heads, an adductor head and the hamstring head. Adductor head start from the inferior ramus of the pubis and ischial ramus, and hamstring head starts from the ischial tuberosity. So, adductor magnus is the largest among the adductor group of muscles. Adductor head, it's having two origins, that is an adductor head and an hamstring head. Adductor head is from the inferior ramus of the pubis and ischial ramus, and the hamstring head originates from the ischial tuberosity. Now the insertion. Adductor head is inserted at the gluteal tuberosity, linea aspera and proximal supracondylar line. So adductor head, again it is insertion also like making two heads, an adductor head and an hamstring head. Adductor head is inserted to the gluteal tuberosity, linea aspera and proximal supracondylar line. Hamstring head is inserted to the adductor tubercle of the femur. Action of the adductor hamers, all of us know that the same work adductor, as the name itself we can understand, it is the adductor magnus is the adduction is the work is action is the adductor adducts the hip joint, along with that it helps in flexion of the hip. So again the depends upon the head, its action is also different, both adduct and along with that adductor head flexes the hip and hamstring head extends the hip. So adductor head along with the adduction it flexes adductor along with the adduction it does the flexion of the hip. Adductor head does the flexion of the hip, and at the same time hamstring head extends the hip. Nerve supply of this adductor group is from adductor head from the obturator nerve and hamstring head from the sciatic nerve. So nerve supply of the adductor magnus, and it is from adductor head is supplied by obturator nerve, and hamstring head is supplied by the sciatic nerve. Now the medial rotators we already discussed about these muscles. The medial rotator muscles are tensor fascia lata, anterior fibers of the gluteus medius and minimus, and lateral rotators are obturator, gemellae, quadratus femoris and piriformis. Now the muscles of the posterior region of the thigh, the main muscles of the posterior region of the thigh is the hamstring muscles. It is located at the posterior compartment of the thigh. Hamstring muscle consists of three muscles. These are semitendinous, semimembranosus and biceps femoris. Hamstring muscle group consists of three muscles: semimembranosus, semitendinosus and biceps femoris. Biceps femoris, the first muscle among the hamstring muscle group is the biceps femoris, and it originates from the tuberosity of the ischium, linea aspera and femur, and it is inserted to the head of the fibula, which articulate with the back of the lateral tibial condyle. So biceps femoris originate from the tuberosity of the ischium, linea aspera and femur, and it is inserted to the head of the fibula. Now it's having two head, a long head and a short head. Long head is nerve supply to the long head is from the tibial nerve, and nerve supply to the short head from the common peroneal nerve. So the main function of all hamstring muscles are the primary flexors of the knee joint, and these are the flexors of the knee joint. So biceps femoris, it flexes the knee joint, along with that it laterally rotates the knee joint. It also long head of the biceps helps in extension of the hip joint. So biceps femoris, it's having two heads, a long head and short head. Long head is supplied by the tibial nerve and short head is supplied by the common peroneal nerve, and these are the flexors of the knee joint. Along with the flexion of the knee joint, this biceps femoris laterally rotate the knee joint, and the long head of the biceps femoris helps in extension of the hip joint. So it's originate from the biceps femoris, originate from the tuberosity of the ischium, linea aspera and femur, and it is attached to the head of the fibula. Next muscle in the hamstring muscle group is the semitendinosus. Semitendinosus originate from the tuberosity of the ischium, and it is attached or it is inserted to the pes and serinus, and its nerve supply is from the sciatic nerve, that is sciatic nerve, and its main action is again the flexion of the knee, and it extends the hip joint also. So the semitendinosus its origin from the tuberosity of the ischium and is attached to the pes anserinus, and these are the nerve supply is the sciatic nerve, and its main function is the flexion of the knee. It helps in extension of the hip joint also. Next muscle in the hamstring muscle group is the semimembranosus. Semimembranosus, it originates from the ischial tuberosity, and it is attached to it is inserted to the medial surface of the tibia, and its nerve supply is from the sciatic nerve, and its action is again knee flexion. Along with the knee flexion, it helps in hip extension. So, semimembranosus, semitendinosus and biceps femoris together makes the hamstring muscle group, and hamstring muscle group, the nerve supply is mainly from the sciatic nerve, and the biceps, among this biceps femoris is supplied, long head is supplied by the tibial nerve, and short head is supplied by the common peroneal nerve, and the hamstring muscle group include the biceps femoris, semitendinosus and semimembranosus. These are the chief flexors of the knee joint. Along with that, this helps in knee extension also. Now we will be discussing about the muscles of the leg. The leg muscles can be divided into different compartments. There is an anterior compartment, there is a posterior compartment, and there is a lateral compartment of the muscle which contain the fibularis muscle or peroneal muscles, peroneus muscle. Now the posterior compartment muscle include the gastrocnemius, soleus, plantaris, popliteus, flexor hallucis longus, flexor digitorum longus and tibialis posterior. Now we will go through the original insertion of different muscles. The gastrocnemius muscle, it include its origin is from the femur itself, and it's a gastrocnemius muscle is a two joint muscle, and its origin originate from the femur itself, and it is attached to the calcaneum. It is inserted to the calcaneum, and gastrocnemius muscle is supplied by the tibial nerve. It is a part of it is from the sciatic nerve itself. Superficial, that is nerve root is S1 and S2. The function of the gastrocnemius muscle, action of the gastrocnemius muscle is the plantar flexion, and it helps in flexion of the knee also. So gastrocnemius muscle is the muscle which starts, it is a two joint muscle starting from the femur, attached to the calcaneum, supplied by the tibial nerve, and its action is, these are the chief plantar flexor, is one of the important plantar flexor of the foot. Now soleus muscle. Soleus muscle starts from the fibula, that is, and from the medial border of the fibula, tibia. So soleus muscle origin from the medial border of the tibia and from the fibula also, and it makes a common tendon with the gastrocnemius muscle and makes the tendocalcaneus tendon, tendocalcaneus, and or it makes the Achilles tendon and attached to the, and it's inserted to the calcaneum. And soleus is also, soleus is a muscle which helps in plantar flexion along with the gastrocnemius. Next muscle is the plantaris muscle. Plantaris muscle is originate from the lateral supracondylar ridge of the femur above the lateral head of the gastrocnemius, and it's inserted to the tendocalcaneus again, and it makes its nerve supply is the tibial nerve, and its action is plantar flexion of the foot, Next muscle is the popliteus muscle. It is originate from the middle facet of the medial surface of the lateral femoral condyle, and it is attached to the posterior tibia under the tibial condyle, and the nerve supply is the tibial nerve, and its function is the medial rotation and flexion of the knee. Flexor hallucis longus, it is attached to the, it is originate from the fibula, that is posterior aspect of the upper 1/3 of the fibula. Origin of the flexor hallucis longus is the posterior 1/3 of the posterior aspect of the upper 1/3 of the fibula, and is come down and it is attached to the base of the distal phalanx of the hallux. And the nerve supply is the tibial nerve, that is S1 and S2 nerve root, and its action is it fluxes all joint of the hallux and plantar flexion of the angle joint. So, this is the flexor hallucis longus. Next muscle is the flexor digitorum longus. Flexor digitorum longus, it starts from the medial side of the tibia, that is its origin is from the medial side of the tibia, and it is attached to the distal phalanx of the all 4 digits, and the nerve supply, again the tibial nerve supplies to this muscle, and its primary action is flexion of the digits. Another muscle is the tibialis posterior muscle. Tibialis posterior muscle, it starts from the fibula and tibia, and it is attached to the navicular and medial cuneiform bones, and these are the tarsal bones, and the nerve supply is the tibial nerve. Its action of the tibialis posterior muscle is the inversion of the foot. It helps in plantar flexion of the foot at the ankle joint. So, tibialis posterior muscle starts from the tibia and fibula, and it is attached to the navicular and medial cuneiform bone, and the nerve is the tibial nerve. It helps in inversion of the foot and plantar flexion of the foot at the ankle. Now, the peroneal muscle, these are the lateral compartment muscles. The muscles include the peroneus longus and peroneus brevis. So, lateral compartment muscles are called peroneus muscle or fibularis muscle. It includes 2 muscles, peroneus longus and peroneus muscle brevis. Now, the muscles of the foot. In the dorsal aspect of the foot, there is extensor digitorum brevis is there. It starts from the calcaneum and is attached to the toes, and the nerve supply is the deep peroneal nerve, and its main action is it extends the digit of 2, 3rd, 2nd, 3rd and 4th digit. Extension of the 2nd, 3rd and 4th digit is the action of the extensor digitorum brevis. Next muscle is the extensor hallucis brevis. Extensor hallucis brevis starts from the calcaneum, and it is attached to the base of the proximal phalanx of the hallux, and the nerve supply is the deep peroneal nerve, and the action is extension of the hallux. Then there are some intrinsic muscle on the plantar aspect of the foot. It is divided into different layers. There are 4 layers can be seen at the foot, the plantar aspect. These are superficial layer, there is a middle layer, there is a deep layer, and there is an interosseous layer. So, the superficial layer consists of 3 muscles. These are abductor hallucis, abductor digiti minimi and flexor digitorum brevis. So, there is a superficial layer which consists of abductor hallucis, abductor digiti minimi and flexor digitorum brevis. The second layer is the middle layer. This is the quadratus. This consists of 2 muscles. These are quadratus plantae and lumbricals. So, middle layer consists of quadratus plantae and lumbricals. And the third layer is the deep layer. It consists of 3 muscles again, and it includes the flexor hallucis brevis, adductor hallucis and flexor digiti minimi. Adductor hallucis is having 2 heads, a transverse head and an oblique head. And there is an interosseous layer. Interosseous layer consists of 2 interosseous muscles. These are plantar interosseae and dorsal interosseae. So, the superficial muscle, the muscles of the foot can be divided into 4 layers. It is arranged in 4 layers. The layers are the superficial layer, middle layer, deep layer and an interosseous layer. Superficial layer consists of 3 muscles. These are abductor hallucis, abductor digiti minimi and flexor digitorum brevis. The middle layer consists of quadratus plantae, lumbricals. The deep layer consists of flexor hallucis brevis, abductor hallucis, abductor hallucis and flexor digiti minimi. And the interosseous layer consists of plantar interosseae and dorsal interosseae. These are the muscles, these are the intrinsic muscles of the foot. Thank you.